I'm Dr. Haroon, 3G IK Hospital, Manjeri. Today, I'm going to discuss with some cases of worm infestation inside the eye, which I have come across recently in some cases. The scientific name of this worm is called Dilophilaria. First, I'll discuss with some of the cases I have seen in our hospital. This disease, that means this worm infestation can occur in any age group. I have seen cases from the age of 7 to 78-year-old lady. First, I'll discuss some of the cases which I have seen during my practice. Recently, the first one was a small boy. His age is 7-year-old. And he came with a recurrent swelling of one eye, which he was getting treatment from many places. What I have seen is, in this boy, whenever he takes medications, his symptoms will come down, and whenever he stops the medication, again the symptoms will come up. That's what I am seeing, and he was getting treatment for more than 1.5 months. And when the patient approached me, when I examined the boy, what I have seen is, when I palpated the patient, there was a small granulomatous lesion on under the upper eyelid. So that means granulomatous means there's a thickening of the tissue. There's a thickening of the tissue, which I got some doubt. So I called up my radiologist, that is my colleague. I called up and discussed with him. He told he will do an ultrasound scan for that. In fact, the boy underwent an ultrasound scan. The result came as linear hypoechoic structure with echogenic cystic wall consistent with worm. That means there is a dead worm inside that lid margin. So what happened is, when we removed that dead worm, the boy got relieved and the symptoms came down and he was perfectly fine. What I want to explain to the people is, see, whenever a person getting this kind of recurrent swelling of the lid, when he takes medication, when they take medication, it will come down. And again, if it is reappearing, please consult an ophthalmologist and get a thorough examination that can be treated. And I'll come across another cases. One lady came with, she is around 50-year-old lady. She came with a severe pain in one eye, and as redness confined to one part of the white part of the region of the eye, that is called the conjunctiva. She came with severe pain, and when she came, I examined her. There was a live worm inside the eye. Whenever the worm moves, again she will get severe pain. So I took her to the OT, and I took a dissection on the conjunctiva and we removed the worm. It was a large worm around 14 centimeters long, and the worms which are very long means they are female worms, and the shorter worms, smaller worms, are the male worms. So I removed the worm and she got relieved. And in fact, another lady came with another complaint as similar to that boy. She is around 20-year-old lady. She came with severe there won't be any pain, severe swollen eye, and she was getting treatment for that. Whenever we give the medication, the swollen area will reduces and she will be relieved from the symptom. Again, it will recur. So this again it's occurring to that lady. And so I called up my radiologist. He did a great job, in fact, the radiologist. And again, he did a ultrasound scan, and same thing has come out. There was a dead worm in that lady also. We removed it, and definitely she was fine, and she went back. And another lady, she is around 60-year-old lady. She is a grandma actually, around 65-year-old grandma. She came with a severe pain, and when she came, I asked her what was it, and she said, just within half an hour it happened. It was severe pain, and there is a redness inside the eye. And when I examined, definitely I saw another worm, live worm, inside her eye. Immediately I took her to the OT and removed it. What I want to mention is, whenever a person getting a severe pain inside the eye and a redness localizing to a part of the conjunctiva, that is a white part of the conjunctiva, try to consult an ophthalmologist immediately and get a treatment for that. Otherwise, this worm can pass through the white part. That means it can pass through the conjunctiva and it can goes behind the eyeball. And it can stay there in the optic nerve or any other place in the inside the eye, and it can cause major problems to the vision. And in fact, I discussed with my neurologists, surgeons also, neurologists also, it can cause some meningitis also when this passes through the back part of the eye into the meninges. So when we do a CSF tap also, we won't be finding any other findings in this one. So this I have discussed with my neurologist also. Then later on, I'll come up with a life cycle of this worm and the epidemiology. We should know two important species of this Dilophilaria worm. That is a Dilophilaria immitis and Dilophilaria repens. Dilophilaria immitis is commonly seen in USA and some part of Europe. Dilophilaria repens is seen in Kerala and coastal Karnataka and Maharashtra. We should know in detail regarding the repens. That is, this repens is seen mainly in the dogs and the cats. They are the natural host. What I meant is natural host means this reproduction of the worm can occur only inside the dogs and the cats. If the worm is there living inside a human body, the reproduction won't be possible. If the worm is living inside a cow or some other animal, the reproduction won't be possible. That's what I meant. Natural host is reproduction possible in that animal only. So an adult worm inside the dog adult worm will lay eggs. That means it will produce microfilaria. This microfilaria will be flowing through the bloodstream inside the dog. And this mode of transmission from the dog to other animal or human being is by a mosquito bites. There are two types of mosquitoes, Anopheles mosquitoes and Aedes mosquitoes. These mosquitoes will spread actually. When a mosquito take a meal from a dog, the microfilaria enters inside the mosquito, and the mosquitoes, it will pass, this microfilaria goes into the mosquito's gut and it will grow into a small larvae. When this mosquito bites another animal, another dog, it will spread to the another dog and the infection will spread. When the mosquito bites a human being, this larvae enters inside the human body, and what happens is our body has an immunological reaction against all these things. Whenever the larvae enters inside the human body, almost all of the larvae enters inside the human body will be killed by the immunological reaction occurring inside the human body. So it can't survive. But somehow, some immunocompromised people, this kind of larvae will goes into the bloodstream, and gradually within a span of 2-3 days it will try to grow. This larvae will try to grow inside the blood vessel, and it will keep on growing, and it will move from the blood vessel, and the larvae will try to find a place where it can grow properly. That's why it prefers to stay in a place called the conjunctiva. That is inside the eye. There is a white part of the eye. That is a conjunctiva. It prefers that area. In that area, why it prefers means it can expand easily inside that area. The conjunctiva can expand, so it will stay. It prefers that area. It will get enough and more food from that area, and it will grow very fast. So it will stay there, and it can grow up to 14 centimeters, which I have mentioned before, and it can stay there. So that is regarding the life cycle. Now I'll come to the management part of the disease. Management is to remove the worm. And another one is we can give, after removing, we can give diethyl carbamazine. The main part which I have to mention is, whenever you get a disease, whenever you notify a disease from a person, try to contact the veterinary surgeon out there. They will visit that place and they will check whether any pets or any other dogs or cats inside the house. They will collect the blood samples from the dogs or the cats and they will check it. If the dogs are infested or the cats are infested, they will be giving appropriate treatment for that. And in fact, they will be checking the neighborhood animals also. They will collect the blood samples from them also and they will do the treatment. In conclusion, I want to say one thing is, no need to, if you see the symptoms like this, no need to get panic regarding this. Please consult an ophthalmologist regarding this and get appropriate treatment for that. Thank you for watching.